Hello, I'm here. You're welcome. Hi, Carla.
Everybody, I'll call this meeting of the McLean County Board of Health to order, and we'll have roll call.
Carla Pohl,
Present.
Corey Pello,
Present.
Anna Eisner,
Present.
Judy Buchanan,
Present.
Richard Janetti, Robert Colhase,
Present.
Scott Hume, Sonia Reese,
Present.
Susan Schaefer,
Here.
Allen Ginsberg.
Present.
And do we have public comment?
No public comments.
Okay, great. All right, so the first item on the agenda is to approve the minutes from the regular session on July 8th, 2020.
Still move approval.
For a second,
Second.
Sonia,
Sorry.
Corey, okay. Is there any discussion? Excuse me. All right, all those in favor, raise your hand.
How should you reference this point?
What? Oh, roll call. I'm sorry, we have to do roll call.
Yes,
I knew
thank you.
that, not. You guys will just pull it. too.
Carla Pohl,
Yes,
Corey Pello,
Yes.
Anna Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti, well, he wasn't here, sorry. Robert Colhase,
Yes.
Scott Hume, Sonia Reese,
Yes.
Susan Schaefer.
Yes.
everybody?
I think you forgot. Did you forget Dr. Ginsburg?
He's not here, so I was gonna try
No,
to do the
Ginsburg,
ones.
no, Ginsburg's here.
Oh, he's
Dr.
here, sorry,
Ginsburg,
Allen
not
Ginsberg,
Janetti.
sorry.
There's one Dr. G here at least.
Allen Ginsberg.
Yes.
Okay, our next item on the agenda is our consent agenda and bills to be paid. They are listed in your packet.
Move to approve.
Second.
Thank you. Roll call. That's why I said,
Carla Pohl,
yes,
Corey Tello,
Yes.
Anna Eisner,
I think she's trying to say yes.
Yeah. Yes.
Judy Buchanan, Robert Colhase,
Yes.
Sonia Reese,
Her lips says yes.
Sonia Reese,
She didn't hear you.
Yes.
Susan Schaefer,
Yes.
Allen Ginsberg.
Yes.
Motion carries. All right, committee reports, Behavioral Health Coordinating Council.
Actually, once again, we have not met. We only meet every 3 months. So the next meeting won't be until September 11th. So.
Right.
Hang tight. We'll have something next time.
All right, are you, just out of curiosity, are you planning on doing probably not a forum, a behavioral health forum this year? Like you have?
Probably doing something like this.
Remotely.
That's
Yeah.
kind of the talk that
Okay,
I'm hearing from Tricia is that she wants to do this. And hopefully we'll have a larger response from it. So we can do it that way.
okay.
So she's working really hard on the plan. Okay,
So we'll look forward to hearing from you in October then.
you will. Well, you'll hear more probably before then. We start to get plans together.
Okay. A mental health advisory board?
Yes, hi. So we met on July 17th, and Amy Hancock, if you want to jump in, please do. Our major things that we worked on that day were to review the 4 focus areas that you'll remember that the board approved, And we also revised edits to the RFP template for calendar year 21. And then we also discussed some ideas for that. You'll remember the $50,000 that we had set aside last year for navigation, a navigation function and a marketing function. We also asked them to kind of brainstorm some ways that could, what could be done in those areas, and got some great ideas. So basically the key points that they brought forward to want to bring forward to this board is number one, the four focus areas, the last one you remember is specialty courts. And their point, and I think it was an excellent one, is if money is always going to be allocated to McLean County Court Services for the specialty courts, if that's going to kind of be a given, then it does not make sense to make that a competitive RFP. It seems somewhat misleading. So the suggestion that perhaps that should just be a designated amount of money that's allocated. And I think Hannah Eisner is going to talk a little bit more about that when she talks about the funding and policy committee decisions that we looked at. So that was one recommendation. The other was to make sure that we think carefully about the age as we looked at the age of adults for the adult service focus area. We had said it should be offered to individuals who are 21 years of age or older. And their suggestion was we might want to rethink that because obviously the 18 is the age of majority for some things. And so we probably want a little bit more flexibility in that beginning age for adult services. So that's something we need to talk about. As far as the RFP process, I think the major thing that we need to bring forward is the possibility that some of our service contracts could perhaps be considered for a renewal idea, so that if certain conditions were met and money was available based on performance and availability, perhaps that some of those contracts, instead of being yearly, could possibly be renewed with less labor expected of both the agency and the health department board that looks at these RFP proposals. And then there was, Amy, was there anything else under those two areas? Okay. And then the other thing was just, again, picking their brains a bit on what would be some better ways maybe to market our services, or some, not maybe better, but new and different ways to market our services. And they did come up with quite a list, which I'm not going to read here, but I think when we get ready as a board to discuss that, we need to incorporate these ideas into that thinking. I mean, one example was maybe make sure that we get information about our service into fire departments in rural areas, since that's kind of a common area where people gather. Also, if we're not already doing it, have information at food distribution sites, since we've now set up lots of food distribution sites around the county. So those are just a couple of examples, and there's quite a few more. So anything else, Amy, you can think of?
No, Corey, the only thing I would add is that we're planning on meeting is at September 18th, and to discuss that money further on, to try to make some plans.
Anybody have any questions?
Thank you. Appreciate that. Behavioral Health Policy and Funding Committee, Hannah?
You skipped Susan.
I'm sorry, Susan. I'm so sorry. That's why. What are you really for? I'm sorry, Susan. If you do the county board, I'm so sorry.
That's okay. The health committee really didn't have a whole lot of issues, but something did come up at Justice, which is kind of going to be talked about later when we talk about the MOU with problem-solving courts. But after I thought about it even more, needs some more discussion just for that, outside of that, is that for problem-solving courts, at Justice Committee, we had a amended contract approval request for CHS because they got PPP money. And so they wanted to amend the contract instead of doing, spending the money on contractual services to training, because they wanted to send some of their team members that are part of problem-solving courts to a conference. And I don't have a problem with, them attending a conference. And so, so that went through Justice Committee, but I had said that I think the Board of Health needed to know that, because I think that we all believe that we're paying for services and not training. And so I think that there was kind of like a little process, misunderstanding as to maybe it should have come to the Board of Health, just so we were aware of what was going on with that. And actually, it's really just kind of money moving around that, but I thought about it afterwards, and it's not this per se, but other agencies that we have funded, and if they've received PPP money, and then we're still supplying them with money, I'm not sure how some of that was working, and if anybody else got any money on that. So how it's going to affect what we're giving the agencies that we're funding, because if they're paying to keep their employees, then we're paying on top of that. And so that's kind of where I'm questioning that kind of thing. It just, and do we need to look at the contract when we do later on the funding, the MOU for problem-solving courts, to make sure that we're always funding the services in somewhere in those contracts? And we don't have to decide that today, but that's something I think we need to think about, because of the way this came up. So, Amy, I know you looked at all this stuff, and I understand how the process of being a subcontractor and a subcontractor kind of thing works, but I think that our expectations are one thing, and then if something changes, then we hear about it, that our expectations aren't being met the same way. Does that
Okay,
make sense?
I'm not sure about, so just real quick, there was a lot I was thinking about with that, but as far as like the PPP, so there are other agencies that receive that. So, but they just recently found out, it originally was for like an 8-week period, and it was to cover money, to cover staff expenses. But now, since the beginning of August, they found out they have 24 weeks to use that same amount of money. And so it does not cover all staff expense or staff salaries. So then that way it gives the agencies, and it's just to clarify, I can't remember what it stands for, but the PPP is for small businesses under 500 people. And so we do have some nonprofits that were able to tap into that. And so then what it is it's a loan, and then it guarantees that the agency is saying they won't put their employees on a furlough or lay them off. But then if they follow through, then they don't have to pay that money back to the federal government. So they found out in August, the beginning of this month, that money, because there was confusion, like what Susan was saying, even with other grants through the state and at county levels, well, we were already funding that. And so it wasn't really helpful in some ways to the agency, because then it was funding. So that is no longer the case. And so it would be if, for example, if I was funded through the Board of Health and then Susie wasn't, and this person wasn't funded by someone else, they're able to use the money now by the employees that weren't being funded. So the PPP, so I was tracking that as far as making sure, like on their monthly financials that they turn in, that they were not double dipping. They weren't using money provided by the Board of Health, and also for also through that federal stimulus package. Secondly, as far as the way that the budget is, if you guys remember last year, when you guys looked at the different applications, there was a budget that was turned in with those applications. And so a budget is just a tool of saying this is how we're planning on utilizing the money. And then they follow through with monthly financial sheets showing how they use the money. So with that, with the budget, there's different line items in that budget that was approved. So for example, when you're talking about CHS, for their budget for problem solving courts, that was to be used for staffing time to be able to go to those recovery court meetings. But then there's other services too. And so they were just requesting, I'm not sure why it was a contract amendment versus just a budget revision. But as far as line item transfers, it is in the contract. It's in the Board of Health's contract that we have with the different behavioral health programs. But like a reminder that that's not the same contract that problem solving courts has, because they currently have an MOU and they're the contractor. We're paying them to subcontract with these other agencies. And so it does definitely get muddy because we have our process. You guys, as far as how budget revision forms work, how line items are transferred. So there's different line items in the budgets. So for example, there is training outlined in the budget where during the RFP process, the application process, there were agencies that requested a certain amount of money for training. Some of them requested money for staffing, benefits, of course, some were travel, some were technology, some were. So in that budget that you guys received with the application, there was 10 to 11 different budget items. So then the way it works is, and they turn those monthly financial worksheets in saying, this is what we used in January. And then they receive a payment. And this is what we used in February. And then they receive a payment. But with COVID-19, and it's very common in contracts to have a budget revision process. And when I came on board, there was agencies that did a budget and then they might use 150% in one area and 60 in another area, and it wasn't being followed. It wasn't being it wasn't being accounted for. And so that's why now in the contract it states, if you said that you need X amount of money for staff, and then COVID-19 happens, and now you don't need that much money for staff, you need it in technology because we need these people to be able to access telehealth services. If it's over 10% of the line item that you budgeted, then you would do a budget revision form to ask permission to take that money take 5,000 from staff to 5,000 to technology. So I hope that answers all those questions, but I agree as far as with like problem solving courts, it gets muddy because I do quarterly site visits. The agencies that they subcontract with, they do provide me with their monthly financials. When we have audits coming up, we are going to do audits again this year on the behavioral health agencies. When those are coming up, we will audit the agencies that are subcontracted with problem solving courts. And that's part of the MOU that we have with those agencies. So we have an MOU with everyone involved in problem solving courts. So it's still like us monitoring it in some way, even though court services is subcontracting. So I'm sorry, that was a really lot of information, but hopefully that helps clarify some of the things.
Anyone have any questions? Yes, Corey.
I had heard, and this was a while back, so this may, with amendments to this may have been taken care of. But at one point, there was some thought that the state of Illinois might take a percentage of that money that was awarded to social services. That all, did that get taken off the table? Because that was something we need to make
I'm
sure,
not sure,
before we
Cory.
take any money away, we need to make sure that the state of Illinois didn't take money away from them, from
Yeah,
that amount that was given.
yeah, I'm not sure, Corey. It's definitely had a lot of it's just continues to evolve.
My point is though, we should make sure we know all of the variables that are at play here before we do something.
And the reason I kind of brought it up is maybe for when we actually do get into talking about the contracts and stuff like that, that we have to make sure that, you know, as this goes on and if there's more money that's being given, whether from the federal government or the state government as to, you know, extra stuff, what we have to make sure that we're watching what we're doing to make sure that we're not paying twice.
Yes, and I was very, very on top of making sure we weren't paying twice. And we will triple check to make sure we weren't paying twice when we do the audits.
Great, thank you both. Okay, now Hannah. Can you give us a report on the Behavioral Health Policy and Funding Committee?
Can you guys hear me?
Yes.
Good. Are you getting it? Okay, there, it looks better. Okay, we met on August 3rd and we were meeting to review the RFP process and looking a little ahead to how we were going to evaluate proposals. And as Corey said, the Mental Health Advisory Board came up with some really excellent suggestions on the RFP process. They suggested having a pre-bid meeting to review the requirements of the RFP. And so I think we thought that was a great idea and concurred with their recommendation on that. And we also talked a little bit about, you know, that we had budgeted that money for marketing or some other purpose for this year that really hasn't been used. So we want to have the next meeting, what we intend to do is have a joint meeting between this committee and the Mental Health Advisory Board to talk about developing policy for that. Let me see, I need my notes here. So with the RFP, I mean, we basically said that what the Mental Health Advisory Board had come up with, we encouraged Amy to find as many outlets as she could to advertise the availability of funds, so we get the word spread far and wide. And we reviewed what she had for an RFP, and I think some of us or all of us may have provided her some feedback. And I assume, Amy, I didn't see it, but that it went out Monday, or did it not? The RFP, that was a goal anyway. Okay, great.
Yes.
So now we've got that out
on
there. We then, okay. And then, and as you saw, we do have an action item, as Corey brought up, there was discussion again about the problem-solving courts. And it did seem to be that, given that this was being allocated and was really just a budget move of transferring money from one fund to another within the county's budget, that it really didn't necessitate going through an RFP process. What we talked about is having Mike Donovan now, who's head of court services, meet with the board or with this committee, whichever the pleasure of the board, to submit a budget to us for that program with a review by us as to the expenditure of those monies. So I think we wouldn't just give them a lump sum and say, do it. What we do is what we've done up till now, which is to have a review by the Board of Health prior to approving whatever amount would be committed to that program. And, you know, I think just a moment on Susan's point with this, I'm sorry that it went to justice, and obviously there's a misunderstanding about the money that should have clearly come to the Board of Health for review. And I think we're going to have to just go through this process. You're doing a great job, Amy, but you know, the notion that people are getting money, I mean, if that was to pay staff salaries to attend that, then there was no need for PPP money to provide that. So I don't know on what basis they submitted their request, but in my mind, I don't know why that would be, we don't want to pay salaries, now we want to pay training. And I'm a little concerned about that, but you know, not that training isn't good, but anyway, that's for another day, I think. So then we also then moved into a discussion of how we would review the proposals we get. And we had quite a long discussion about who should be involved in doing that. And we, as a committee, came through with the concurrence that it should just sit with the committee. In the past, the Mental Health Advisory Board members have been involved in the process. But the good news, bad news is we have a greatly expanded Mental Health Advisory Board with people who are providers of services in the community. Prior to that, we had the chiefs of the fire and police department and ROE and others. So these people are more directly hands-on, and we were concerned there potentially could be a conflict if one of those agencies wanted to apply for funds, and maybe the sharing of what might be considered proprietary information. So, and we also thought our advisory board is really those people who we want to pick their brains about policy and practice, and not really assign them so much of the what I'd call grunt work of going through these proposals and scoring them. So our position, and I guess our look to the board, if anybody has strong objections, is to have the proposals be reviewed by our committee. What we want to do is put the Mental Health Advisory Board on the task of figuring out what to do with the $50,000 that we had allocated for 2020, which we have not spent yet. We're halfway through the year. And also to the difficult task that I'll talk about is how we're going to deal with all the fallout from this pandemic, and certainly the major mental health issues, and what can be done. Not that we don't want to limit them to only how do we spend this $1.5 million that we have allocated for mental health services. We'd like them to be advisory to a greater extent and be able to talk about things that may not involve funding from us, but could facilitate collaborations or looking at resources that may be out there that have not been looked at. So we did not certainly want that group to feel like they were not appreciated. In fact, they've really, really been greatly helpful through this process thus far this year. So that, I don't know if any of the members of the committee have anything else to add to that. We do have the issue at the action item later to determine whether we want to move to removing the specialty courts from a RFP process. So anybody else, feel free to jump in if there was something I left out.
Thank you,
Oh,
Hannah.
all right.
Anybody have questions? Okay, we'll move on to the Health Department Administrator's Report. Ms. McLean.
All right. You want me to move that? I'm not very tall, sorry. So, part of my report did include an update from the Clinical Health Services Division. And I know that the Division Director, Tammy Brooks, that she's on the line. So if there's any questions about that report, speak now.
Does anyone have any questions about the packet? Ms. Reese is giving fives.
This is Bob.
Yes, Bob.
Since I'm not on the video and I don't have materials in front of me, at some point, I'd like to have more discussion from Jessica. And I know there was a spreadsheet was sent at around 5, but or maybe about 5. But I would like to have discussions about the expense side. I know I've seen some things on the revenue side related to the current economic conditions we're dealing with. But I'd like to have some discussion of the impact on the expense side and how that's working out with our reduced, potential reduced income at some point. So whenever it's appropriate, I'm just injecting that question when you want to address it.
I'll go ahead and address that now.
Carla, I had as well.
Go ahead, Hannah.
And I agree with Bob. I wanted to talk about that. And while I'm thinking about it, there were some references in the report about applying for HHS COVID money to replace some lost Medicaid dollars. So I just want to hold that thought. I guess the dental report, just generally asking, it looks like, I know we have gone through many years of looking at dental and being concerned about the losses and that we incur in trying to provide the dental. Talked in the past about maybe partnering more. And it looks like we had great success with just providing some funds to allow people to get services through private providers, which is great. But there was mention of making this a dental home and whatever, and I guess I wasn't sure where the thinking came from at this point about that, as opposed to looking at other organizations that are providing this dental and our struggle to make enough through our services to really continue it. So why should the health department do that instead of finding that one single place that might provide dental across the board for the community? And then I'll just put my second question was on the flu shots. I understand completely what you're talking about, Tammy, but we have had that cost center for a while for the giving flu. There was some thought a couple of years ago about maybe having a revenue center for giving flu shots. So I didn't know how that was maybe being looked at down the road as far as budget.
Tammy,
So
you
that
want,
was my questions. Just
I'm here.
okay, do you want to answer those or address those?
So the thought behind being a dental home comes from a couple places. One being, it's very concerning to us that particularly in our adult patients, they only come to us in times of emergency, and we want to try to kind of change attitudes about that. Attitude isn't the right word. We want people to receive preventative services as well, and perhaps put a damper on some of those emergency situations. I am greatly looking forward to collaboration with other community partners. I have spoken with Community Healthcare Clinic, who is currently serving only their own patients. So that wouldn't be an option for the people that come here. And we're all waiting for the day that Chestnut's Clinic opens. I did hear a rumor that maybe they did get some money that they were trying for. So that might be coming in the future. However, I don't know how that will look as far as if they will only start out by seeing their own patients who already come there for primary care. I'm not sure what that's going to look like. So rather than waiting for someone else to pick up the slack, I feel like we can act now and start providing better services for the community, providing better education that encourages them to take better care of their oral health. And the other thing is a lot of the grants that I've been looking at, they mention the idea of being a dental home. So I think that's kind of a common term that I've seen as I'm looking for other monies. They're saying they give preference to clinics who promote being a dental home for their patients. As far as the flu clinics, I'm not sure I know what you're talking about. Did you say a call center?
no. Your report suggests that we are going to, at least for now, kind of getting out of the business of giving flu shots. Did I read that correctly? And maybe I read that wrong, but I read it as if we were not necessarily going to be. Okay. And I know that we have a program out there where we will. Yeah. So my only question was if I understand the reasoning behind it, but if we also have in our budget it's 96 is a program where we had actively, I think, tried to recruit businesses and schools and whatever so that we could provide flu shots, and we would bill insurance for it. So I don't know whether we foresee that happening still or not.
So at least for this year, the problem is we don't have a way to staff flu clinics, as well as the concern of social distancing. The other thing that helped us to kind of make that decision, because that was a tough one, was that flu shots really, there really isn't much of an access issue for flu shots. Everyone gives them. So as far as it being a revenue source, last year, it brought in about $10,000, which depending on, which pair of eyes you're using to look at that amount, that could be a lot, could be not much. When you compare it to the amount of staff time and coordination that it takes, that's something that Jessica will have to consider more for next year. I just know that speaking of this year, unless some miracle were to happen, it seems nearly impossible to me that we would be able to do that in the usual manner.
Did that answer your questions, Hannah?
Understood the,
I do have.
yeah, and I just think we need to look at as we review budget, we do have that program revenue reflected in it. So I just,
Okay. Corey, did you want to have a comment? Okay.
I just wondered if, Tammy, is there any kind of a dental collaborative group that is starting to meet regularly? I mean, it just seems to me that the two federally qualified healthcare centers and you, and, if there's any other entity, it might be, because this seems like this has been hanging, and I know part of it is a funding issue, but I'm just wondering if our role might be to kind of be a catalyst to kind of move things along here. If you think that it makes sense, and it may be that I may not know enough to that this is a wise thought, but I'm just wondering if there should be some regular ongoing communication among those entities so that there's some, clarity and movement in our community. And again, I realize right now there's so much on everybody's plate, you tell me whether that even makes sense right now, but it just seems like this has just been hanging for a long time.
It does make sense that we should be meeting. And I did establish communication with Community Healthcare Clinic. The other provider has not been responsive to my reaching out for collaboration. I will say that part of the John Scott Commission funding process changed for this year. They put government and school entities in a category separate from everyone else. And we have all been in collaboration in I guess just paying for dental services, not necessarily who's going to provide it. But so there are some baby steps that we've taken in collaboration, but we certainly do. It will benefit us all if we kind of up the game in that.
Judy?
Yeah, just a couple of questions. And first, Tammy, I appreciate your proactivity on this one. And as others have mentioned, this has been a budget item for us for a while. And it appears that we are working toward getting on the good side of this one. And as I'm listening to what the other two providers have available, it appears to me that we need to continue to be proactive and provide those services through a dental home or some other mechanism, because there is not a site for others to go to, and I don't know when that's going to be available. I did notice, Tammy, that you contacted those organizations that we've previously done flu clinics with to let them know, the current situation. Did you offer them any options or any suggestions for where they might look for in the future? I know the physicians' offices and the drugstores are doing it. How are we going to encourage that for people that might have been looking to us in the past?
So the letters have not gone out yet to those sites. I'm still working on the development of that.
This was kind of a tough area because we do know of some places, pharmacies in particular, that will do workplace flu clinics. But as I started to make that list, I thought about how we would account for not mentioning some when we mention others. So that's why we kind of changed our wording to referring people to their primary care provider and or pharmacy.
And I think that's probably a good idea. And in one respect, it's unfortunate we can't continue this because I've watched us grow this program to being a self-sustaining, and it sounds like maybe a source of some new revenue. I hope we don't have to get out of this business because people have relied on us, and it's been a good effort for public health. But I think it's also it's advisable to just suggest there are other options, but not naming names. So thank you.
Sonia? Go ahead. Oh, no.
Yes, I want to go back to the dental.
Okay.
Oh, were you calling me? No.
Yes. Your
Yes.
voice did come through.
I was go back to the dental. There was a reference in there to teledental. And I'm not familiar with that. And I didn't know if that was something that is new. Is it going on? Are there places doing it? Scott, you may know as much about teledental as some of the rest of us, but I was curious about that and to see whether that was something that was simply where you told the doctor where it hurt and went from there. So can you explain a little bit about teledental?
So it's my understanding that teledental was new to everyone. And it's something that, an idea that was quickly thought of just to address the concerns with COVID-19. There were two methods of teledentistry, one being synchronous, which means you do that by video. So your patient would actually be on the video, you know, and you could say like, open your left cheek and point to the tooth. Then the dentist at that point would make a determination. Yes, that is an emergency. You do need to come in and see me, or let me call in a script, or that's not something we can take care of right now during this time of an emergency. And there was also a secondary method that was asynchronous, which means you would take pictures and send pictures to your dentist if you did not have a method or a means of video. So we did actually do that. In the story I shared about the youth at the juvenile detention center, we used the asynchronous method. The nurse at JDC was able to take some pretty good pictures and send them to us, and our dentist was able to you know, kind of diagnose the situation, and we were able to get him the help that he needed.
Boy, that's great.
Dr. Ginsburg.
I'm not sure if this tails into the flu vaccine clinic, but I remember back to the 2009 H1N1 pandemic. And that year they were able to come out with a vaccine very quickly. And I believe that the health department at that time played a very large role in distributing those vaccines because it was like a massive vaccination program for the whole county. I understand everything you've said about the flu vaccine clinic, and I don't know how many people we're talking about at this point as far as flu vaccine, but are we in any way, have we heard any information, or are we in any way in a planning stage for how the health department is going to deal with a coronavirus vaccine?
So I can speak to that. We're definitely working with IDPH. It's one of their items where planning has begun. So we're starting to look at that, and you know, we have our our plans for other mass vaccinations. And so it's more in line with what we're familiar with in terms of pandemic response. So we're already starting to really even look at how we're doing our mobile testing as kind of a model for that planning a little bit to, and again, we have our pods already, some of them already identified, but we're definitely planning already.
Good.
Susan?
I have a couple of questions. One on the flu thing. Are you going to be providing county employees with flu shots if they request them?
So we are open to anyone who wants to schedule an appointment with us, but we will not be doing mass clinics.
Okay. So, but then when, on the paragraph above that, when you're talking about community health services with TB and adult immunizations, STD and all that stuff, you make it sound like that clinic is closed so that you're not doing any of those kinds of things?
Partially correct. So we are continuing with the brown bag testing services, which is currently being run by the CAUSE program from ISU. So our McLean County Health Department staff is not dedicated to doing any of those services at this time.
So how does that affect any of the grant monies that we get for some of those things from the state if we're not actually providing those services?
So actually, I misspoke. We are still doing HIV services. So that is a grant that we're meeting those objectives because we are still doing that.
Okay. So the clinic is closed. So if some adult, like I got my shingle shot there, okay? So if some adult wants a shingle shot, they can't get it through the health department.
They could make an appointment to get it, and that might be a situation where perhaps the children's immunization staff would cover a service like that.
Okay. And so how long do you envision this being closed?
Well, until there are much fewer COVID cases, or until after the contact tracers are hired and trained and are able to take over that operation.
So you're saying that all your staff is doing contact tracing, is that what, or not all your staff, but many of the staff that are doing the contact tracing, which is why you can't have the clinic open?
Yes, all of the communicable disease staff, including their front desk staff, have been pulled away from the front desk and trained in contact tracing. And we do have other health department employees that are actually doing contact tracing as well.
Corey?
Is that what other public health departments around the state are doing as well right now? I mean, because it does seem like those, and I realize you're totally between a rock and a hard place. Please do not misunderstand me. And please know that I continue to hear I hear often from social service agencies and educators how much they appreciate the guidance that you all are giving them on COVID, that it has absolutely, they talk so much about the high quality of communication and the high quality of information that you have been providing as they've had to make decisions about things. So please know that we are deeply appreciative of all you're doing. But I guess I just was wondering, is that how other health departments around the state have handled this? Have they just had to put all those kinds of immunization kinds of things just on hold? Because that seems, especially with the flu season coming, that's a problem. Yeah.
Yeah, I could speak to that, I guess. It's not just even across the state, it's across the US. Health departments it's kind of all hands on deck really with contact tracing. And, you know, I'm proud to say that our health department has been open this whole time, and some health departments have shut down their services. And we have kept as many of our services, if not all of them, open and accessible to a point. Again, making appointments versus walk-ins, or the brown bags being available, just a different way. So I'm really proud of us, but across the nation, health departments are struggling, and really it's contact tracing, case investigation that has taken top priority.
Which makes perfect sense. Thank you. That's just good, I think, to clarify that for the public, that, it's not that you in any way, shape, or form do not want to be doing the work that you always have done. It's that you literally have to make the contact tracing a top priority for the health and safety of the county. So thank you.
Yeah.
Okay, so Mr. Colhase, did we answer your question, or was there something else that you wanted to discuss?
No, just because I'm driving, my point was to have a snapshot overview at some point by Jessica or whoever about the expense side of during these times, and just comparing the expense and the revenue side, because I couldn't really tell the impact of the changes in our operations because of the COVID situation. So it's really more of a snapshot of how we were doing on the expense side, because for a few things I looked at, I couldn't readily determine that.
And so really just, I guess, a brief snapshot today in terms of our budget, looking at 2020 compared to previous years, and kind of trying to gauge an impact of COVID. Like I've mentioned before, I think are really where we're seeing any impact is those in-person services. So any clinics that we have had to scale back, we're seeing an impact there. So WIC, our communicable disease, the testing and treatment, dental obviously, but we are also seeing areas through our contact tracing grant, our COVID grant, that will help kind of make up for some of those losses. Plus, again, Tammy and staff being resilient and looking for funding that will make up for some of those revenue losses. So, some salary that would have been in other programs is covered now by these other grants. As far as our programs, our grant programs, those are still looking okay in terms of the revenues we're receiving from the state. So I feel good about that. And I feel pretty good about the budget where it's at now, but obviously the next couple months will tell. And we're still trying to keep as many of our services open as possible and be creative with it, knowing that it's not going to be the same as 2019.
Did that answer your question, Bob?
So are you saying that is the reduced services and expenses commensurate with reduced income, or are we balancing out and trending where we're at year to date? I guess is the simple question.
We're slightly below where we were last year, and on trend for it 6 months in certain areas. When it comes to revenues for those contracts, those are pretty much right on trend. But when it comes to the clinic services or anything where it's fee for service, then we are below where we were last year and where we kind of should be for trend. Covered by different grant funds because they're expenses related to COVID. So, certain supplies and things like that where we might be spending more, they're covered by those grant funds.
Okay, so it seems like we, thanks to your guys' leadership, we are doing the best given the situation that we are not in a dire situation, but we are managing the cards that were dealt us.
Mm-hmm. Yes, definitely.
Okay.
Somebody had their hand up. Hannah, Hannah, go ahead. Thank you. Go ahead, Hannah. Go ahead, Hannah. Okay.
Okay. And just following up, one of the things that as we look at the budget going forward, I noticed in some of those areas, we often fund transfers from our unencumbered fund balance that don't get made because we make it without it every year. So I would strongly encourage that we look at actually making those transfers. So, if we need to hire additional personnel to cover some of the other services because we had to divert our personnel to contact tracing, then I would think that we should look at doing that. We'd have to do some budget amendments to get that done, but it might be worth looking at. And I agree, it's wonderful that you guys have done as much as you have under these circumstances. And yeah, there was reference, I think, at Tammy's report to a COVID grant. I apologize if I should know more about that. What are we expecting to get? And that is to replace some of the Medicaid revenue, it looks like.
Yes, so the COVID relief grant through HHS will provide up to 2% of our total Medicaid and CHIP revenue from 2019. So they take a look at how well you did in 2019, and they will award you up to 2% of that amount. The $100,000 grant that I applied for was a COVID relief grant from the Illinois Children's Healthcare Council. Thank you, Carla. You sent that to me, and no one else did. So that was specific to the children's dental clinic. So what I asked for there was some coverage for salaries as well as lost revenues.
Susan.
I have one more question on the children's immunizations. Since school is virtual, pretty much, I think, everywhere in the county, and I know that there has been concern about a lot of children not getting their immunizations, and those have been delayed and things like that. Kind of a multi-point question. Number one, have you seen an increase in requests for appointments for those immunizations for school? And then do you think that that's going to continue to be put off by doing them because school has been virtual instead? And how are you reaching out to those people that are your clients that you had in the past to try to get those?
So yes and no. I actually just had a conversation this afternoon with the children's immunization supervisor, and she stated that there is a trend in parents calling to cancel appointments now because school is going virtual. So it's very early in that conversation to know what's going to happen with that. As far as we know, the schools have not changed their guidelines. They still are recommending that kids receive those vaccines so that when they do start a physical presence at school, they will be ready. So I'm not sure what can be done about the people who are canceling. We actually had experienced this throughout the pandemic. People often become afraid to come into the clinic. So there have been lots of cancellations along the way because people aren't ready to come into our clinic for fear of exposure.
Any other questions for Tammy? Thank you so much, Tammy. Did you have some more for your report?
Unless there were other questions about anything else in the report from the administrator.
Sonia, go ahead.
This isn't a comment on the report. I just wanted to thank you for your Wednesday afternoon presentations online when you go on and answer questions that were coming from the public. I think that's just one more great opportunity for people to sign on, see you, type a question in, and go. I was able to type the question in about, are you still looking for contact tracers? And the answer was, yes, you are. And so I immediately was able to do a quick text to a friend and say, yes, they're still looking. So those kinds of exposures take more time of yours, I know. It's just your schedule has to be a total nightmare. But I just wanted to say thank you for it. You're appreciated in many ways, but that one was one this afternoon.
Thank you. Anyone else?
You're welcome.
All right, we're going to move on to our next agenda item. Then it's healthy eating, active living discussion. Judy, do you want to, which one of you wants to start the discussion? Kathy to go on? Oh, yeah. She's off the top seat. You're up.
Good evening, everybody. Just as included in your board packet on pages 21 to 29, the narrative portion of the Community Health Improvement Plan that addresses healthy eating, active living, one of our 3 health priorities. And as just a note that while this is focusing on healthy behaviors, that we hope to indirectly reduce diseases like heart disease and diabetes and other things that impact, that weight impacts. But our focus is really on healthy eating, active living behaviors and how we can improve those and expand them in our communities. So I can leave it there. If there's questions, I can go on or give you updates.
Yes, Corey. There's going to be questions.
Places that have been identified as as either being a food desert or, just having, just making it harder for people to access grocery stores. What are some of the strategies that the community is doing about that?
There are several activities going on in that area. One is that you're probably familiar with from our previous CHIP is Veggie Oasis that was put together initially by an ISU initiative, and they were working with West Bloomington Revitalization Project. That is although still in place, was kind of put on hold once COVID started. But back in the spring, the Invest Health team still had some remaining grant funds to distribute. And we had over $18,000, and we asked for some applications and were delivered 2 grants, 2 awards to Sunnyside Community Gardens and to West Bloomington Revitalization Project, both of which are in that 61701 zip code area. To help with, I think with the Sunnyside, they helped, some of the funding helped to buy some equipment as well as to pay for a part-time farmer to help with the garden and really professionalize that a bit more. And then West Bloomington Revitalization Project used, I think, to help with several different activities. One was a CSA that they were promoting and helping to pay for their clients. So those are two very concrete activities that have gone on just since the beginning of this CHIP that were initiated. Since COVID, the HEAL Priority Action Team has met several times. It's going to meet again at the end of August, on August 28th, I believe. And they, since COVID and since job losses have occurred and loss of income has occurred for many of our constituents, food insecurity was, again, a huge concern for that team. And we had already, before COVID, we had 12% of McLean County was experiencing food insecurity, and that put us in that 50th to 75th percentile range, and the worst, comparing us to other counties in Illinois. So we still had some issues with food insecurity prior to COVID, and we were anticipating that it would only get worse with COVID and the loss of income. So I know the June HEAL Priority Action Team meeting consisted of a lot of the agencies involved, and there's already at least 36 people who represent a variety of organizations who are on that team. And they shared what all was going on in the community, and it's been astounding. I mean, you're probably very familiar with the schools breakfast and lunch programs, and I know just from District 87, they served well over 118,000 breakfasts and lunches since COVID, and that was between mid-March and July 24th. And then they donated over 10,000 leftover meals to Midwestern Food Bank. So, and then there's collaborations that are going on, United Way and Bloomington Normal and Beyond, healthcare facilities, churches, businesses, the food banks. Others have gone together to assure that there are food boxes and food distribution continuing to occur and increasing in McLean County during COVID. And I think the HEAL Priority Action Team was able to account for 86,000 meals that were served and over 2,800 food boxes that have been donated in the past about 5 months. So there continues to be efforts. And then on the physical activity side, something to report, because a lot of the fitness centers were closed down and the kids weren't in school, there were still efforts being made to expand our physical activity abilities in the county. And one of the items that our normal Parks and Rec representative on the HEAL PAT mentioned that Normal has seen an increase in utilization of Constitution Trail. And that was good to hear, that was people were getting out and about on the trail. So that was the good news. In addition, the HEAL PAT asked its members to all contribute what they knew of wellness-related apps that people could use. So the group compiled an 8-page list of apps that could be used, and they distributed that among the membership and then the members to their distribution lists. So that was, and they were all free apps, by the way, too. So
That is the best news.
yeah. So there's still efforts going on despite not being able to see each other in person, and it's been encouraging despite COVID.
Judy?
That's all really very good, Kathy. Thank you. The action team and what you mentioned in terms of West Side and ISU and a couple of things that we've looked to in the past. Now we have a number of other things, and particularly United Way's effort is tremendous. Who is the convener, or who is taking responsibility for keeping those conversations going with all these new partners? Is the action team doing that? And, you know, I guess my concern would be, we've got some great things happening. We may need to continue that kind of activity, and how are we pulling it together so we do have a process that's going to go forward?
Yeah, the Priority Action Team really sees that as part of their role, and to not limit the membership either, as more of these collaborations and more partners are out there with activities going on, that they would be asked to join the HEAL PAT as well if they would like to. As a group, you know, we do annual reports of what the Priority Action Team members have accomplished that fits into the CHIP. And so they have a spreadsheet that for each of these, the intervention strategies, and are already, we're only about 6 months into the new CHIP, and already are listing what's been going on in there. So they're keeping track, and they rely on the membership to provide the liaison to that group, who's Erin Kennedy from OSF St. Joseph. And she keeps track of all the data and all the progress that we're making.
Is there any reporting out? And I know in the midst of COVID, we're all pretty focused on that. But is there any reporting out, for example, of what the situation had been and what the community is doing to respond to it in terms of the food securities?
I would love to hear some ideas about where we could do that, because I think that would be of interest to the community and not just the HEAL Priority Action Team or the McLean County Community Health Council, but for sure to the council.
Mhm. Thank you.
Mhm.
I'm
Sonia?
thinking, get back to you.
Sonia?
Yes, I think maybe in response to Judy's question about reporting out, this whole process with United Way, bringing people together is a great gathering point for a lot of these reports. We've had Sally Gambacorta come and report where things stand with our efforts that have been going on the report that you just heard about, and many other areas. So trying to keep that momentum going because it started out with food, and now it's so much broader than food, and it's mental health, and it's childcare, and it's rent, and it's all the things that if you miss one of those things, your life is in trouble.
Mhm.
And so food is part of it, but if you don't have childcare or you can't pay your rent, all of that goes up in smoke. So I continue to marvel at the collaboration that has come together in this pandemic. I'm just so appreciative of it. So many parties together with it. Thank you.
Sure. And it's really, it's encouraging to see. We're not surprised. We're a community that does collaborate, but it's really an encouragement during some discouraging times. So.
And I was just going to add that the town halls that United Way has been convening, I think to the extent we can hold up what we are doing, right now we need to provide some hope and some security for people who've been insecure. So I would encourage us to really make use of that medium, the town hall, as well as promote the dickens out of it in terms of people signing in and listening.
Mhm.
Yeah. Thanks, Kathy.
Sure.
Thank you. Anybody else? No. That's good. Thank you so much. Mr. Anderson, are you on the call? I hope he is.
Yes, I am.
Okay, do you want to give us a brief overview of the fee increase freeze information that you found out?
So in 2014, an amendment was made to the county code to facilitate the fee increase process, and it was an experimental use with the geothermal well fees only. And what the Board of Health at that time wanted to do was to see if they could expedite meetings and their process of approval by having an automatic increase of 3% at that time every year, unless the board decides to have a different change or to freeze it. So that was written and presented to the Board of Health and to the county board, and it was approved by both, and it was approved by the Illinois Department of Public Health. So Jessica has informed me that there is consideration in freezing some of the fees for next year. And one of those, as I brought to attention, if the Board of Health so desires to freeze the geothermal well permit fees, that they would have to do that by a vote according to the county code.
Tom, is that
So
the
for
only
tonight-
fee that has to be, is that the only area where there's automatic fee increases? Is geothermal?
Yes, they
Okay.
wanted to try it with the geothermal first because it was the smaller of the programs compared to the septic system program and the food program. So for tonight, it's for discussion only. If the board finds it in the interest of the public to freeze those fees, then it would be put on the agenda for the next Board of Health meeting to be voted upon.
Any questions? And we had talked about freezing the fees this year just because of some of the difficulties that folks are facing. No question.
Just, do we need more information about what that looks like in terms of revenue and is there more information we should look at before we decide that?
So in putting together our budget for fiscal year 21, we went ahead and created it as though they were the same as this year. So it is possible in the budget.
Thank you.
Susan? No?
No, well, Jessica just answered the question that they used the numbers for this year. And so basically was the budget that they proposed, that they're going to propose for 2021 is going to be frozen.
Anyone else? Because a whole bunch of hands went up. I think that answered it. Okay, so you'll see an action item on the agenda for next month. MOU and BAA with Illinois State University Student Health Services. Yeah. To save myself from having conflict of interest, I think you better be talking.
Yep. So we are collaborating with ISU, their student health services, to utilize some of the contact tracers that we're hiring with this grant to specifically be dedicated to ISU contact tracing and case investigation. So we're looking to have an MOU and a business agreement with them because they will be using the Illinois State program for contact tracing. So they'll have data and just for security purposes, the business agreement, but then also the agreement about what this looks like, this collaboration, what we're going to be doing and what they'll be doing.
Any questions? Discussion? Okay.
Yeah, the agreement's been drafted. The state's attorney's office has looked at it, but it'll be in the packet for.
I was gonna say, that's probably
Sounds like a
interesting timing, because while we were on, I just got a text from somebody saying there's hundreds of students out at the corner of College and Linden, and nobody's got a mask on. So there we go. They're back. They're back. Full swing. No mask.
Not what Tammy and Jessica want to hear, let me tell you.
I know, I'm telling you. And my neighbor at the other side of the building just sees it all.
So much for the pledge that they all signed. And I'm not even gonna
I know.
apologize for start. All right, we had received some information from another county health department on trying to encourage a mask ordinance at the local level. And we had a little bit of a discussion that we can't tell people to do it, but we can encourage some of the local areas to encourage a mask ordinance. It's not on the agenda as a action item simply because I didn't want to blindside the mayor of Normal. Okay, but the mayor, it sounds like the mayor of Bloomington is, so I heard this on the news that he may be actually pushing for a mask ordinance. Did anybody else hear that tonight, or was it just me? So I guess the question is, do you want me to go ahead and talk with some of the other mayors that are in the area to see if they would consider adopting a mask ordinance?
I suggest you talk with the city managers in both cases and let them float this up to their mayor. Because it's a situation that would have to be, if it becomes an ordinance, then is it something that has to be managed and policed, and there's so many things to it.
Right.
I'd run it that way.
Susan, thank you. Susan, I'll get
Yeah,
you.
that's the enforcement issue is something, whether the mayors do it or not, it's still an enforcement issue.
Right.
And and how it relates to the governor's order, from what I understand and what I've read is that it's the county health departments and law enforcement that issue fines and warnings. And so, because that's how they've made that rule. And so my question is, on that, is that even regardless if there's a mask ordinance by the city or the town, how is that, okay, I see Samantha coming up. How is the health department going to do this and be the enforcers of fines? And do we have to create a fine structure, or how is that going to work? And I mean, understand how it's like the fine doesn't happen until the third time and you're like blatantly, not enforcing masking in your business, because it's the businesses that get the fine, not the individuals.
Right.
And so, whereas a mask ordinance from the city or the town would be for individuals. And so there's a lot of enforcement issues that come along with this. And I don't know where everybody's at on that. And so that's kind of, Samantha's probably going to talk about it.
Let's let Samantha, Judy, I'll get you in just a second. Let's let Samantha answer that question first, and then I'll get you, and then Hannah after that.
So the emergency amendment that went through last week has a pretty detailed plan as to how enforcement will work. And that is up to the very end, nothing has changed from what we have today. So the rule's the same. Mask all the time unless you can social distance by 6 feet. Now, the health department or any other law enforcement agency can enforce that by giving notice to the place that is not in compliance, giving them time to get in compliance. Also, if they're not doing that, they can issue an order to disperse to gain compliance. And then at the very end of that, if that entity, whatever it is, it's a business, organization, facility, or what have you, refuses, then they can start the process of enforcement and prosecution. And so at that point in time, there's a due process that we would treat it as every other prosecution we would have for a misdemeanor. So it would go through the state's attorney's office. There would be a court involved. And at that point in time, only after all of that would a fine possibly be issued. So the health department is not the one to give out fines. Law enforcement are not giving out fines. The way this enforcement would be is after we get to that point that we need to talk about misdemeanors and fines and holding some business accountable for refusing to comply, then that's when the possibility can occur.
Yeah, see, that's not how I read it. And I think that there's a lot of misconception on that, because what I read was the county health departments can issue fines without going to the part where you're actually prosecuting for a misdemeanor. And so that's, and that I think just finished, that was just yesterday, the JCAR rule. And so and I think that there's a lot of people that believe that the health department is going to start issuing fines for the blatant ones, like I said, after they've done the warnings and that kind of thing.
Well, my understanding is that it points to a section already established, and just for note-taking purposes, it's section 8.1 here, and this is going to be a section that's already established. So any violation can be deemed guilty of a Class A misdemeanor, and the Director of Public Health can institute prosecutions. It also implicates talks about the state's attorney and the prosecution. So that's what I'm talking about. The prosecution process would have to start at that point in time. And it references section 8.1, which has already been an established measure. Now it can be used against these business entities. I am not sure if we're talking about the same thing about something happened yesterday, but this is from the emergency amendment that I know was put into place as of last Friday. That
I
would've been-
think, I think you might check the JCAR rules that it just got,
And that doesn't,
Hang
and that
on.
doesn't speak to what would happen with the city.
Correct.
Judy.
Yep, thank you. Yeah, I think that, and just starting with a little levity, the other day when I was talking to Jessica and some of the staff, I need a budgetary amendment because I did offer to get them all little shiny badges. So enforcement. One of them mentioned that they wanted something more than that. But anyway, Jessica and Carla, I think the idea of contacting all of our mayors is a especially good one because there are differences of opinion. And if we go public and really begin to move with this, we need to know where our cities stand. And I would suggest that we look at whether they're thinking about ordinances or some advisory, and maybe pull together a coalition so that the response to this is fairly united. Relative to the enforcement, I think there needs to be a lot of clarification. The violation piece, it sounds to me, and if I could direct this to our legal counsel, if the health department identifies a violation and has through the advisory process come to the step where now there is no compliance, there's no effort to comply, is that the role of the health department at that point then to document the violation and in fact then turn it over to the state's attorney's office and we are out of it at that point. Is that correct?
That is the way that I am reading the amendment from last week. Yes. And
Because
so
I haven't seen JCAR's wording, but I had the impression that they agreed with the governor and the way he wanted to proceed. Is that your understanding?
I'm not familiar with JCAR.
Well,
I'm
they had to review it yesterday. It's a legislative group, and they review, it's a joint committee on administrative rules. So there are legislators on that committee.
and it was also, under DCEO, it was under DCEO's rules. And I'm looking it up and I can send you a link if you need it.
Sure, thank you very much.
And again, just going back to, I think, a caution, I'm in no way suggesting that we not be very out front and very aggressive with this because it's reinforced daily the importance of wearing masks in terms of controlling the pandemic. But I think we need to be very clear on our role and communicate that with our mayors and move forward in a united way, because the community does not need to sort of have the impression that we are going to be, enforcement police and doing some things that are just not in our lane and not something that we feel we have a right to do. So I think we need to be real clear and then also have the support of many others.
Do we also have the manpower to do the accountability checks that would be required?
I
Because
thought I was,
Hang on,
Good
Hannah.
question.
So my
was
understanding,
next on the comments.
Item.
and I can refer to Jessica here, but my understanding is that the process up until the very end is gonna be the same. So there is, and correct me if I'm wrong, there are people who would normally, and up to this point, investigate complaints about face coverings in businesses or other group organizations. And up to that point, nothing has changed. It's just at there's now an additional enforcement mechanism. So I think the manpower is already established.
We've been doing that, as I understand it. Tom has mentioned that.
Correct.
And they've been, and correct me if I'm wrong, Tom, but you've been following that process of educating, talking, problem solving, that type of thing.
He's not-
Yes, the process that's been outlined by the governor in the emergency order is exactly what we've been doing to date. The only thing we don't have is true enforcement ability to make the business comply with what previous to yesterday was, or, yesterday guidelines. Now, the question about municipalities, and I can have a discussion with Samantha in more detail about this. I perceive that that would happen as we receive complaints on such as property maintenance violations. We'll take the complaint, but then we have no authority to enforce a municipality's ordinance. So we send that complaint over to the appropriate department of that particular municipality. It's up to them to do the enforcement. We have no authority to enforce their ordinance unless we have a mutual agreement.
So are we saying that we then direct that to a local municipality's legal counsel, or are we to direct it to the state's attorney of the county?
That's a discussion that I would have to have with Jessica, but to date, when we have a property maintenance violation, if just for simplicity, if it's in Normal or Bloomington, we send that complaint to the town of Normal or the city of Bloomington because they have a system and enforcement people to address that. It's part of
And
their
I
ordinance.
spent a large part of my career doing city of Bloomington ordinance violations. So the city
Go ahead, Samantha.
I'm sorry. Right, so if we're talking about ordinances, Tom is absolutely correct. It would go
Okay,
to,
my turn.
I'm sorry. Somebody's
So-
cutting.
Go ahead, Hannah. It's just you cut in and out, so it's really hard to hear every word that you're saying.
I haven't been talking. I've been waiting for my turn. So Samantha was going to answer something, so I was just waiting for her to finish. Can you hear me? Am I still cutting in and out?
A little bit. Go ahead. Go ahead and ask your question.
No, I was just going to speak to the issue of whether we should take a position on encouraging the cities to pass their own ordinances. I think our discussion tonight about how we do it under the state guidelines shows how cumbersome that process can be to actually come to any, and there's a sense in which, and Tom, you and I went through some of the smoking stuff together. I mean, when they pass the smoking ban, this is a little bit what we're dealing with the mask ordinance, in my opinion, on the state level. The city ordinance would be enforced by the city, by their law enforcement or whoever they chose to have do it. They go into the bars, they do bar checks all the time. I'm sure they could notice if people are not wearing masks. My feeling is it's a two-edged sword then. The ordinances would say individuals must wear the masks and allow some enforcement on that side, which may be as much as a warning. I mean, the point is not to generate revenue or to have big enforcement, but it's a position that states strongly that the town and the city and other municipalities believe in the value of wearing masks. And so I'm a very strong proponent of contacting them and saying, it's a public health issue. It's appropriate for the health department to ask you to do your part in this. And, you know, I think that there's so much fear of, well, what about the enforcement? Well, I think there's a lot that comes of the strong public statement of an ordinance that says you as an individual should wear a mask to protect everybody and yourself. And those ordinances would not be, I think, Tom, you're right. If it's a city or town or other ordinance, you may, as a courtesy, pass that along if you notice it. And we had talked about whether you were doing that now, although they don't have any ordinances in effect, but it would be the city of Bloomington or the town that would enforce it. And it would likely be an ordinance violation, which is a very simple method of sending a message to somebody. It's a ticket. So, you know, I think we can stumble all over ourselves for fear of somehow this can't be enforced and that's a problem and why we shouldn't do it. And I think I just really would like to see us press for those ordinances being passed. I think, did Leroy pass the one? They were talking about it last week. Did Leroy pass it? And I think Decatur has one. I mean, many cities are doing this. There's a model ordinance that the municipal league has put together. So
Sonia, go ahead.
Well, I was going to add, this becomes a question of, in many cases, is it an ordinance violation of the establishment that somebody is in without a mask, or are we stopping people on the street, as I just described, people out on the street and dealing with them without a mask? That's a huge difference, and in both cases, terribly problematic. And so I really encourage any discussion to start with the county administrator and the 2 city council managers to at least lay out to them and ask what would be a process and how are they viewing this. They will be a good audience.
Judy.
Yeah, and it does say in the governor's release yesterday, a couple of days ago, the rules do not apply to individuals. So I think we are talking about the businesses. And my comment about enforcement was not in any way to suggest that we take that lightly. It was more, as we have discussed, to define whose responsibility that is going to be. And it sounds like it is going to be the local municipalities via an ordinance, if they will so do that. And we take the lead to try to get as many of them to respond in that way as possible. And maybe, as Hannah suggested, take a look at, with our council and with the cities, the model ordinance that the chamber, is it the chamber or some state organization has already put together. I think we need to stay on this one.
Okay.
yeah, and Sonia, you're certainly well taken, but having been on the town council, that a lot of this is that we trust that there's common sense application of this by not having vigilantes out there to catch people not wearing masks, that it's generally a complaint driven system. And, I think in particular, like the students on the street, it would be nice to be able to say to those students that they can't have alcohol in a public place. I mean, there's plenty of things out there that the police enforce in a way that's reasonable, and I would expect them to.
I agree.
Muted yourself, or you're muted. Okay, any other comments or concerns? And you're good.
Any questions? I'm good.
Great. Thank you so much. Appreciate it. Thank you, guys. All right, we're going to move on to our action items. In your packet on page 30, there is a fiscal year 21 HIV grant through IPHA. Do I hear a motion? Sonia, second?
Yeah, I move approval.
Okay, hang on.
Nice.
Go ahead.
To get it on the table.
They want discussion first?
Is there any discussion on this grant?
Is just clarification. Is this a new grant? It refers to a regional service. Is that something we've done before, and do we have the capacity to do it now?
It's not a new grant. It is not a new grant, so yes, we do have the capacity.
I'm good. Okay, thank you.
Any other questions or discussion? All right, if Amy will call the roll for the vote.
Carla Pohl,
Yes.
Corey Kello,
Yes.
Hannah Eisner,
Uh-oh. Oh, there she is. There you go.
Yes.
Judy Buchanan,
Yes.
Robert Colhase,
Yes.
Sonia Reese,
Yes.
Susan Schaefer,
Yes.
Allen Ginsberg.
Yes.
Motion carries unanimously.
Rich,
Our next-
Rich Jeanette,
Oh, I'm sorry. Dr. Chin-
I've been listening, guys. I just didn't get on, couldn't hear me on YouTube, switch over to the phone, so I'm good.
Oh, okay. Thank you.
I didn't know he was here.
Me either. All right, so our next contract is approval of contracts for the COVID-19 contact tracing grant, and we've been talking about this quite a bit. There's a position for epidemiologist, contact tracer supervisor. I can do these in a group, right? Because it was. They're listed together. Great. The resource coordinator and office support assistant. Yes, Corey.
I was just gonna move, but I think Susan was gonna move too, so I can second. Susan can move and I'll second.
Okay, so guys, sorry, we have to do them individually. I tried. So we're going to approve a contract for the epidemiologist first.
I'll move that.
Second.
All right. Any discussion? Questions? All right, Amy, call the roll.
Carla Pohl,
Yes.
Corey Tello,
Yes.
Anna Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Sonia Reese,
Yes.
Susan Schaefer,
Yes.
Allen Ginsberg.
Yes.
All right, our next item is approval of contracts for the COVID-19 contact tracing grant positions of contact tracer supervisor.
Don't move.
Second,
Second.
any discussion or questions? All right, Amy, call the roll.
Carla Pohl,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Sonia Reese,
Yes.
Susan Schaefer,
Yes.
Allen Ginsberg.
Yes.
Motion carries unanimously. Approval of contracts for the COVID-19 contact tracing grant positions of contact tracer. Motion.
So move.
Second.
Approval.
Amy, call the roll.
Carla Pohl,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Sonia Reese,
Yes.
Susan Schaefer,
Yes.
Allen Ginsberg.
Yes.
Motion carries unanimously. Next item is approval of contracts COVID-19 contact tracing grant positions for the resource coordinator.
Move approval.
Second from Susan Schaefer. Any discussion or questions? Amy, call the roll.
Carla Pohl,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Sonia Reese,
Yes.
Susan Schaefer,
Yes.
Allen Ginsberg.
Yes.
Motion carries unanimously. Next item is approval contract for the COVID-19 contact tracing grant position of an office support assistant. Do I hear a
Move
motion?
approval.
Second is
So moved.
Cory. Discussion or questions? Amy, call the roll.
Carla Pohl,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Sonia Reese,
Yes.
Susan Schaefer,
Yes.
Allen Ginsberg.
Yes.
Motion carries. Thank you so much, everybody. The last item on the agenda is approval of funding the problem-solving course in the form of a memorandum of understanding.
So
Move
move.
approval.
Second,
Second.
thank you. Does anybody have any questions or discussion on this item? Okay, call the roll, Amy.
Carla Cole,
Yes?
Wait, did Hannah have her hand up?
Oh, I'm sorry. Hannah, did you have a discussion? No, I think everybody's,
No, I did not. Thank you.
move along. I think, because everybody's unmuted, and that's why I'm looking, I don't see anybody's hand. Anybody having? Corey, Sonia, you guys, okay.
Okay.
Sorry.
so Carla Cole,
Yes.
Corey Tello,
Yes.
Hannah Eisner. Hannah,
She's frozen. I don't. There she said yes.
okay. Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Sonia Reese,
Yes.
Susan Schaefer,
Yes.
Allen Ginsberg.
Yes.
Motion carries unanimously. Is there any other business for the good of the order other than adjournment? Yes, Judy.
Just, and I know you all join me in expressing our sincere gratitude to our wonderful staff for what they are doing day in and day out, and in some cases 24/7. So thank you all.
Be sure they know it, Jessica. Thanks, you guys. Appreciate it. Anybody else?
I just was gonna say, Judy said she was gonna get them badges. I say they need halos. They're angels and superheroes all rolled together.
We may be able to scare up some halos for the staff.
Good, sounds good.
All good.
All right, anybody else? Do I hear a motion to adjourn?
I'll move.
Second.
Alan, do we have?
Do we have to roll call for adjournment?
No.
All virtual meetings roll call. Okay. One last time. Carla Cole,
Yes.
Corey Tello,
Oh, yes.
Hannah Eisner,
Sorry.
Hannah,
Yes.
She's taking over again.
Judy Buchanan,
Hi. Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Sonia Reese,
Oh, yes.
Susan Schaefer,
Yep.
Allen Ginsberg.
No, I want the meeting to go on for at least another 2 to 3 hours.
All right.
Okay.
Thank you so much.
Let us know when you're done.
I love getting the last word.
Then I guess I better shut up so you can have the last word. Everybody have a good week. Stay safe.
Thank you.